CDC is now calling it multi-system inflammatory syndrome in children, MIS-C. So we will, from this point on, refer to it also as MIS-C for consistency with the federal government. The CDC has confirmed a link to COVID-19. So this is important. We've assumed it, but they have done additional research to 100% confirm it. And they've released a standard national definition so that the whole country, doctors, scientists all over the country can share information, common definition, and we can all work together to understand how to fight this back. So it begins with, since it is linked to COVID-19, you've got the immediate point that everything else we do to fight the coronavirus, we need to do to fight MIS-C. So that means the hygiene, the washing hands, the hand sanitizer, the coughing into your elbow when you cough or sneeze, all the basics, using the face covering, staying home to the maximum extent possible, social distancing, all of this helps make sure our children are not exposed to this disease. And that's the best way to avoid this challenge because it keeps COVID out of the equation. Now, the symptoms. We've talked about several of them, but I want to add, because the CDC research and definition has added additional symptoms to the equation. Persistent fever, irritability or sluggishness, abdominal pain, diarrhea, vomiting, rash, conjunctivitis, which is shown as red or pink eyes, enlarged lymph node gland in the neck, red cracked lips or red tongue, and swollen hands and feet. So that's a lot to be aware of. Any of those symptoms you see in your child, call your healthcare provider, check in immediately. If you see multiple symptoms, especially important to get your doctor, your healthcare provider immediately. If you don't have one, call 311 and you will be connected to a health and hospitals clinician immediately. Now, right now, the number of children affected, the previous definition we used was 145. Under that definition, we've confirmed 145 kids affected. 67 of those cases tested positive for COVID-19 or had antibodies. And we did lose one child. And again, our goal is to never lose another. We'll have updated numbers with this new definition, the MIS-C definition, shortly. But the bottom line is the additional news, the additional information from the CDC allows us to hone our approach more, but the same bottom line. Look for these symptoms in your child. Act quickly if you see them. If they get to healthcare quickly, children can be brought through this safely, and that's what we all need to do together.